And now, it's BoomerLife, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is BoomerLife on CIL 650.
Well, hello and welcome to Boomer Life here on CIL 650. I'm Sterling Fox, and boy, have I been looking forward to this program for a while. We have a cosmetic surgeon on the line, and we're going to spend an hour with our guest, Dr. KimitRai, surgical director at FalseCreek Healthcare Center. And boy, in the summer of 2015, cosmetic surgery is certainly a very front and center topic. So first and foremost, welcome to Dr. Rai from FalseCreek Healthcare Center.
Thank you.
It's a pleasure to have you with us. You're a UBC grad and board certified here in BC since 1975, Dr. Rai. You've been at it for quite a while, sir.
That's right. I've been at it for a long time, yes.
What drew you to cosmetic surgery in the first place, if I may ask?
Well, basically it is we do a series of reconstructive surgery for many years, and then you have your expertise available with you, and then you decide to see that the whole image of improving aesthetics of the face and body and trunk, and basically, when things look well and good, you try to participate in that program. And I find that it's part of people's lifestyles, and they want to look well and presentable. So I think that's the way to go, and I like that specialty myself, and I still like it. Yes.
Interesting, after all of these years. Well, and there's a lot to be said for that, the kind of commitment that you make as a young doctor, that lo these many years later, you still enjoy the work as much as you thought you would when you started.
Yes, I still love my job. It feels good to make people happy and make them look well.
And there's another aspect to your work besides FalseCreek Healthcare Center, Dr. Rai, that I want to spend a moment on, because you and several talented colleagues from across Canada participate in a surgical exercise every year you call Operation Rainbow. Almost 20 years into it now. Tell us a little bit about this endeavor that you and your colleagues conduct overseas every year.
Operation Rainbow Canada is an organization, it's a non-profit organization. It is registered charity in Canada, and we have a group of maybe about 25 to 30 members who go on missions to treat children who are in third world countries, especially who have facial deformities like cleft lip, palate deformities, or hand deformities, and some of them may have some postponed contractions, but we concentrate mostly on children, and because they need to have an opportunity in life in the future, and we do all our work pro bono, and we so far have done over 2,000 children across the world and reconstructed their faces, and in dollar value I would assume is more than a few $1 million now.
I'm sure. Now, we've seen your television commercials for Operation Rainbow, and they really do tug at the heartstrings, because you see these very young children being brought to these clinics by their parents, and the physical deformity, especially with a cleft palate, is quite obvious. Yes. And yet the television commercial shows in a second or two as it shows the work that you do on these children, and this very frightened looking little child all of a sudden with this beautiful smile and a reconstructed mouth. It's wonderful stuff.
Thank you. Yeah, it feels good when you see it yourself. You kind of evaluate your outcomes, and we're very happy that so far we have had very successful outcomes in the last so many years. Yeah.
I don't imagine it's too hard to recruit volunteers to accompany you on these exotic exercises every year either, is it?
No, it's not. It's just that the commitment and time is the issue, and some of them can't come because of other involvement. But on the average, yes, you're right. We're able to get a lot of volunteers who want to be on the mission to support the organization, to do the work that we do.
And in 2015, Dr. Rai, the mission is to a new location somewhere in India. Tell us what your destination is in 2015.
In 2015, we are going on November, I think, the 19th. Going to this hospital in Gujarat, G-U-G-R-A-T, Gujarat, in central India.
Okay.
And the hospital is called Kakaba Hospital, and we are working with this physician. His name is Dr. Champanyalo in India, and we are communicating to make sure that we are able to bring our supplies and buy some products down there that we need to do the reconstructive surgery on these children.
Right.
And we will be hopefully treating at least 80 to 100 children or more during our 2-week period that we are there. We have a team of 32 of us that are going to be leaving Vancouver and going via Hong Kong or via Japan, and then from there to central India. It's a long trip, but I think we hope to have successful outcomes.
Well, of course, and as you've discovered over the past 18 previous trips, an entirely worthwhile endeavor, too, isn't it?
That's true, yeah. It feels really good. All of them are happy when they come back, and you still remember the faces, even after 18 years, of the parents and the children, that you can see how happy the whole family is that they're able to have a new lease in life, yeah.
And to our CIL 650 listeners, Dr. Rai, the next time you see one of those wonderful Operation Rainbow television commercials with those children with the deformities that are so easily and so wonderfully reconstructed by Canadian surgeons, now you've heard the leader of that team on the radio, and you can feel even more comfortable about donating to Operation Rainbow. Right, Dr. Rai?
Yeah, we appreciate that. Thank you very much. You can just look under OperationRainbowCanada.com, and they can go on the website and look at what we have done and involvement, etc. Thank you.
Excellent. Okay, now let's get back into Vancouver and FalseCreek Healthcare Center, Dr. Rai, because we've talked very, very briefly about the sort of work you do on children in underprivileged circumstances in faraway places. Back home here in Canada, in 2015, you talked about the popularity of cosmetic surgery and how people basically, in your words, just want to look better. So what are the most popular forms of cosmetic surgery these days?
There are different varieties depending on what happens, and I think in my mind the number of cases we see are mostly, for example, breast augmentations are very common.
Right.
And then as we mature in life, they come in, they want to rejuvenate their faces, and so we have both non-surgical and surgical techniques to achieve the outcomes. Some of them need combination of skin care. They need combination of maybe some fillers to improve the appearance for time being so that they can delay their surgery for later.
Right.
Some of them do need eyelid surgery, facelift surgery to rejuvenate their faces so that in this present world we are competing for jobs, etc., and positions, and so everybody wants to look well and put their best foot forward to achieve their outcomes. And so on the other aspect, some of them might have had, some children and the tummy is a bit loose and they feel that their body is deformed and end up having tummy tuck operations and liposuction to contour their bodies. So we're basically trying to work from head to toe as far as we can to achieve the goal for them.
It's interesting that you would mention that some people, certainly not all, Dr. Rai, but some people go through these cosmetic surgical procedures in order to maintain a certain youthful look, because in the real world of employment, there is a lot to be said for that sort of youthful presentation, isn't there?
It's true. It's presenting your best foot forward, so you want to look the best, and we dress well, we present ourselves well, so they want the biological situation also to look well at the same time as they can. So we eat well, we exercise, we take care of ourselves, and then you combine that with your whole body image to improve that to the same capacity. So,
Dr. Rai, is there a point, though, in a person's life, a chronological point, in which a request for a more youthful look in terms of a cosmetic surgical procedure, and you, the surgeon, sit down with this person and go, well, in your particular case, you're not looking for employment. It's not about economic survival or any of that sort. And at this stage in your life, perhaps you're kind of overreaching. Do you find yourself saying that to people at all, or do you just oblige?
No, we just look at the situation and tell them that, for example, you may find someone asking for a procedure that you think they don't need, and then you have to be realistic and tell them, you look well, I don't think I can give you what you want.
Okay.
That happens, but many a time as we get even mature in age, you may find that, my skin has got a lot of wrinkles and I want to look better.
Sure.
So we give them the options to look better. They want to be presenting themselves in the world in a very more positive fashion. So, but overall, as a surgeon, we assess the problem they present with, and if we feel that they already look very well when you can't make it any better, you just tell them, I don't think I have the expertise to give you what you want, and it happens a few times, yes.
Right, of course. Well, at least you have, at least you're honest with these people, because I would expect, bottom line, even though they may be disappointed in what it is you have to say, they would appreciate your candor.
That's true, yes. I think it's many a time we have seen that, and I just tell them I can't give you what you want because it's not possible, because you already look, from 0 to 10, 10 being excellent, you're on the 9 and around 8 to 9 level.
Right.
So just tell them, I think, maybe you should think of something else and, carry on your life.
Mm-hmm. Dr. Rai, you mentioned breast augmentation surgery, and I want to pursue that for a second, but I have just a curiosity question for you. Yes. A few years ago, friends of ours with a teenage daughter, they obliged her when she, at roughly age 16, maybe 17, decided that she wanted breast reduction surgery.
Yes.
And I wonder, and I've always wondered since those days, is that a smart thing for a 16 or 17-year-old to do, to have made a decision about at that early point in her life?
Have to see the problem, because you sometimes do see pubertal hypertrophy, that is people in the age of 12 and 13 having very large breasts and very uncomfortable. They feel intimidated, they are in difficulty, and so you have to assess the situation, talk to the family, talk to the patient, and maybe even get some psychological support to know that they really want this procedure.
Right.
So 16, 17, yes, it does happen. More like 17 or 18 would be a better option when they're fully grown, rather than we try not to operate under 18 years of age. So
right.
And at that time, if they have symptoms like back pain, shoulder ache, and very, very uncomfortable, you have to oblige to try and help them out. But if they feel that they are comfortable with that position and don't want surgery, that's fine. But overall, that's what happens. And you're right. At the age of 18 or so, if they have very large breasts and very uncomfortable, and feeling intimidated about work,
right,
sports activities,
sure,
going to school, and it's bothering them in their education, then I think you're obliged to help them.
Is it a risky procedure?
It's not risky. Anything is risky in terms of when you're undergoing an anesthetic.
Of course.
Overall, with the expertise we have, usually they heal very well. They're over 90% outcomes and successful outcomes.
Okay. What about the augmentation side of breast surgery, Dr. Rai? At what age, typically, would a woman come to you requesting this procedure?
I would suggest that it would be better to see those patients after the age of 18, and because they are adults and they make their own decisions. But
right.
Under that age, I wouldn't recommend that, because I think they're still growing and not completely settled yet. So most of the patients we see around 20 and 21 who have been born with very, very small breasts and are very intimidated and not feeling very confident at school or education-wise, and it's surprising to see how well they do after they've had the breast augmentation done.
Interesting, because the stories of breast augmentation surgery, did they still use the same silicone bags of silicone that they've always used, but of course have improved over time?
They use both. We have saline and gel bags, both together, but they are higher quality. They're better. They've been investigated and found to be safe, and all research has been done in the recent times to complement the outcomes. Like anything, as years go by, the product gets better and better. So,
of course.
So right now we have the best products that are available to achieve the goal. And yes, you're right. The bags have been modified over so many years, and complication rates are a lot less these days than they were in the past. So.
Well, exactly, because you just don't hear or see stories in the papers that you used to see fairly routinely. The days of seeing a breast augmentation surgery go wrong due to saline leaks, that's kind of old stuff now, isn't it?
Well, we don't hear that much, but the important thing is we educate our patients well. They have a very well informed consent. So it's like being aware of the problems, and we address them. Yes, you can still see leakages, but we take care of them pretty well, and it's all very well planned and processed at the present time than it was in the past. So.
Right. Now, you talked about the whole notion of cosmetic surgery and the kinds of conversations you have with prospective patients. Could a lot of it fall under the general category, Dr. Rai, of anti-aging?
You can combine that, yes, in the anti-aging process. The youthful look is the basic language that they use today. The rejuvenation is what they want to have, and I think those are. It's basically anti-aging is a multitude factorial feature. Is all related to diet, exercise program, and surgery. If you combine all that together, and skincare, etc. So you have a big a group of events that you have to address to give you the anti-aging program, if you want to call it.
Well, I'd like to pursue that, Dr. Rai. I'd like to get a little bit more into what anti-aging programs are all about in 2015. But first, sir, I need to take a quick break. This is Boomer Life on CIL 650. Our guest for the hour is Dr. Kimit Rai, the surgical director at FalseCreek Healthcare Center. The topic today, cosmetic surgery, with lots more still ahead. Stay with us. We'll be right back.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.